We are inching closer to cold and flu season. Health experts are urging everyone to prepare for that, especially those who are most vulnerable. Dr. David Persse is joining me now to discuss best practices for minimizing risks and staying healthy. Good morning, Dr. Persse.
Good morning, Haley.
So talk about the types of illnesses that are most common this time of year. What are we seeing going around right now?
Yeah, so let's start off with some good news. So, we had this summer COVID wave, which is coming down very nicely finally. And it was also a pretty late wave in the summer. And COVID continues to be confusing because we're seeing a summer wave and then this winter wave. And as you said, most of the respiratory illnesses that are virus-based tend to be in late fall and winter. And those usual suspects, if you will, include the flu and respiratory syncytial virus, which we've talked about in the past. And then there's also all the colds, the rhinoviruses. And then I also want to remind people that there's a whole other family of viruses that we call para-influenza viruses. They have many of the same symptoms as the flu, but they're not the flu. They're not as severe. And a lot of times people get confused thinking they had the flu and actually they had a para-influenza virus. So I always remind people, when you get the flu, you know, because I was taught in med school, I love this, this is so accurate. I woke up feeling fine. By noon, I was so sick, I was afraid I was going to die. And by 5 o'clock, I was so sick, I was afraid I wasn't going to die. Now, that's a little tongue in cheek, but the point is that when you get the flu, it comes on very fast, very hard, and you become very, very sick very fast. That's the flu. The other ones that are like the flu, but a little bit less severe, those are probably para-influenza viruses. Again, these are the ones that we see late fall and winter.
And so when we start to see a lot of people getting sick and it feels like it's all around us, sometimes people just kind of say like, oh, well, if I get it, I get it. But how can we reduce our chances of actually catching one of these illnesses?
Yeah, that's a great question. Two things about that. I really wish people wouldn't be thinking, oh, if I get it, I get it. And the reason is that these viruses spread one person to the next. And when they finally get to somebody who has a lot of medical problems, or it's an infant, a newborn, and they get it, they're the ones that are going to have the really bad outcomes, and some will die. And so I really don't like the idea of, well, if I get it, I get it. I'm young, I'm healthy, I'll probably be fine. You're also probably going to spread it to somebody, and we want to break that chain of transmission. So what are the things that you can do? Well, there's a lot of the things, and it's plural. Unfortunately, there is no one thing that you can do to prevent you from getting these seasonal illnesses. So flu vaccine, COVID vaccine, we've talked about those 100 times. They are really effective, and again, not 100%, but they are very effective. Then there's the hand washing and the social distancing and just paying attention to, if you walk into a crowded room, how close you want to get to folks. If you see people sniffling or coughing or they just don't look well, you might not want to get too close to them. A lot of it is common sense. One of the things I think that is most underrated and most underappreciated is just washing your hands with soap and water makes a big difference. And then cleaning those commonly touched surfaces. And you know what's a commonly touched surface we never clean? Your keyboard. So, at your computer, especially if it's a computer that's used by lots of folks.
That's a good point. So those will be your tips for preventing the spread of illness. Once you know you're sick, is to clean up those areas, wash your hands, take all of those measures.
Yeah, and in fact, not only just wait until you get sick, right? Because with some of these viruses, COVID in particular, we came to learn the hard way that people are actually infected and spreading the virus before they even have symptoms. So it used to be, we used to think that, you were okay until you started developing symptoms. COVID, we know that's absolutely not the case. But also a couple of these other viruses also have that unfortunate feature. So you really ought to be doing these things all the time. And not only will it prevent you from spreading it once you have symptoms, it'll prevent you from catching it if you do those same things to protect yourself and your family. Remember, the person you're most likely to infect is a family member, followed by a coworker.
Yeah. Dr. Persse, why don't you take a minute to express to those caregivers what they need to do, the ones who are protecting the immunocompromised. What kind of precautions should they take this season?
More and more of us are taking care of ill folks at home, most commonly an elderly person, but also sometimes somebody who's dealing with something like cancer or a chronic immune compromising illness. So if you're the caregiver, you really need to be a little bit obsessive compulsive about protecting yourself first. And then you need to work on the environment that you take care of that person. So a little bit of obsessive compulsive cleaning needs to go on, and make sure that if they're eligible to get vaccines, which most even the elderly folks, they can. As we get older, there are different formulations for example, the flu vaccine, because as we get older, our immune system gets a little bit weaker, so it needs a stronger boost. But I think just a little bit of being a little compulsive about making sure that everything is clean, that I, as the caregiver, that I stay healthy, and that they get the medications and the vaccines as they need them.
And you know what, Dr. Persse, so during this season, we also tell people that you got to know what you're dealing with. You need to go in, get tested for the flu, get tested for COVID, because there are antivirals that can be prescribed to you to lessen the severity of the illness. Talk about, where do people even get tests anymore? I mean, are at-home tests good? Do they need to go to a pharmacy? Does the city of Houston offer tests?
Yeah, so the at-home COVID tests are pretty much ubiquitous right now. You can find them in all the pharmacies, and whenever I go to a pharmacy, I always look to see and make sure that they're there, and they're available. So, and they are really, really very, very accurate. So the COVID tests are good. Now, the flu tests are not offered on the shelf in the store. So very often you need to go to an urgent care center, or perhaps your own doctor's office. You can go to the emergency department, but that is probably the most expensive way to get yourself tested, is to go to an emergency department. So an urgent care center or your doctor's office would be better. And you're right. So with flu and with COVID in particular, there are antivirals that you can take. Now, here's the other thing. You want to take them as early on in that illness as you can. So once you start developing the symptoms, you want to go and get yourself tested so that those antivirals will have the maximum impact and maximum benefit for you.
Yeah, Dr. Persse. All right, very good information, especially as we are heading into this season where we know a lot of people are going to start getting sick around us, especially since school started and all that. So thank you for your time this morning. We appreciate it.
Of course, Haley. Have a good day.
You too.